event of an outbreak. Again, as we've been previously saying, please do not go to the emergency room unless you have a true medical emergency. If you have to call 911, tell your operator about your symptoms so that responders can take the appropriate precautions. If your symptoms are manageable at home, please stay home until you are 7 days away from the onset of symptoms and have improved and are 72 hours fever-free without fever-reducing medications. If you are sick with other symptoms or symptoms become unmanageable at home, please call your healthcare provider to discuss a treatment plan. Don't wait too long to call your doctor's office or to go to the ER if you need to. We want you to seek medical attention if you need it and when you need it. We assure you that healthcare systems across Tulsa County are taking extra precautionary measures to make sure patients can safely visit doctor's offices, emergency rooms, and urgent care centers. The Tulsa Health Department has partnered with the Oklahoma State Department of Health, the Oklahoma Department of Mental Health and Substance Abuse Services, and MyCare to offer citizens receiving services at THD who may find themselves in crisis. Starting next week, clients coming into THD for scheduled services who may be identified by our staff as experiencing domestic abuse, addiction, or stress can use iPads in a private room to televisit with a counselor for free. For a free public mental health resource, the Disaster Distress Helpline is available by calling 1-800-985-5990. We are still projecting a peak of new infections to happen within the next week. So this time is crucial for staying home as much as possible and limiting social contact. We are aware of the talks about opening the economy back up. I've looked at what the president has put out and are having conversations with local leaders at this time about how to do this consistently throughout Tulsa County from community to community. I think it's important when we look at reopening small businesses, we let the data drive that conversation rather than a specific date. Regardless, the important criteria is if testing has expanded enough to gauge in a true count the virus penetration in Tulsa. We want to know that hospitals have enough PPE because when people come together, there's a possibility of another surge or another peak. When we begin gathering again, we will see that surge, and we want to make sure hospitals can address this issue without being overwhelmed. We will continue aggressive contact tracing measures here at the health department, but again, as numbers increase, we will look at how we're going to continue to manage that. I have no doubt that Tulsa and our state will survive this crisis. I would rather look back at our actions today as being overcautious and being criticized for that than relaxing these restricted measures too soon. The last thing we need to see is more people getting sick in Tulsa County, and more importantly, we don't want to see any more deaths in Tulsa County. I do know everyone is anxious about opening back up, but let's resist that temptation. We're doing things the right way here. If we continue restrictions, this will last less than if we open things up too soon. We truly appreciate everyone's patience. We are pulling through this, and we are going to get through this. So that being said, I would like to introduce at this time Mayor Bynum.
Thank you, Dr. Dart. Please stand by. Mayor G.T. Bynum, City of Tulsa.
Thank you, Dr. Dart. I can never say it enough times how grateful I am for you and your team and the guidance that you provide us here in Tulsa as we try to keep people safe. There are several important things I want to talk about in today's briefing. The first is the one that we're certainly hearing a lot about right now, which is how we re-engage so much of our economy here in Tulsa. I think it's important to distinguish two different tracks that we're working on. You know, the great Tulsa businessman who did so much for our city, Wade Phillips, had a great saying that I always think about, which is the when is as important as the how. And those are the two things that we're really focused on right now. The when is one that I really rely heavily on the Tulsa Health Department to let us know when is a safe time to re-engage parts of our economy that have been necessarily closed down due to the coronavirus pandemic that's afflicting the entire globe. And in the conversations I've had with Dr. Dart, what we recognize is that what we have to do is look at overall positive test cases in Tulsa. Now that testing is widely deployed, as you've heard Dr. Dart mention before, we now have at the Tulsa Health Department the ability to test people. If you have one symptom, you can call the Tulsa Health Department or your healthcare provider to get a test taken. The state of Oklahoma has over 80 different testing sites set up around the state for people to get the tests that they need. And now that we've established much better levels of testing than we had at the outset of this, we're able to get a better feel for the daily rate at which we're being afflicted with this virus and the rate at which people are contracting it. And so all the modeling that we've had to date shows that this week is anticipated, as I've said many times, to be the peak of the contagion rate. But we won't truly know that. That's based on modeling. We won't truly know that until people who have contracted it this week, and it's usually about 3 to 5 days before people start to notice symptoms of having COVID-19. And then they can get a test. We would expect to see those tests. If this week truly has been the peak of contagion rate, we would expect to see those tests also peaking sometime next week. The key for us is that you want to see a decline over a period of time. In some cases, it's 7 days. In other cases, it's 14. But you want to see, at the very least, 7 days of declining daily positive tests in a community. And so the Tulsa Health Department, as they report that data to us on a daily basis, that's the number that I'm keeping an eye on. And in conversations with Dr. Dart and looking at the data that's out there from Centers for Disease Control and others, what you really want to identify is, one, do you have that steady decline in positive tests? And then two, does your hospital system have the capacity to handle the number of hospitalizations that you're seeing? And if you have both of those cases, that kind of answers a lot of your when question as to when we could start to roll back some of the social distancing practices that we've had to put in place in our community over the last month. Now, the other big aspect of this, though, is the how. And I don't want anyone to have the assumption that we go and flip a switch and everything is the way it was in February. I've not heard any public health professional suggest that that's what ought to be done. I haven't heard the governor suggest that. I haven't heard the president suggest that, contrary to what seems to be interpreted by a lot of their statements. But what I do hear a lot of people talking about, and what we will do here in Tulsa, is a phased approach. And that is a way of cautiously proceeding with reopening aspects of our economy that have been shuttered, but not necessarily reopening them the same way that they were in February. There are modifications that need to be made to make them safer for people. And I'm very grateful for people like Elliot Nelson, who's helping me identify ways that we can do that with restaurants in Tulsa, people like Marilyn Iloff, who's helping me identify ways that we can do that with salons. Anna America, our parks director, is helping with a lot of park aspects and public recreation aspects. And so we're talking with business leaders and community leaders here in Tulsa about what those modifications look like when the health department has given us the go-ahead to start rolling things back. Any of those modifications, I'm also going to want the health department to review and make sure that they tell us that these are the things that can keep people safe. And I think it's very important for people to understand that this is as much about public confidence as anything else. The governor could lift every order tomorrow. I could do the same. But if Tulsans don't feel safe to go to businesses around our community because they think that things were just opened up willy-nilly without any acknowledgement that there's still a virus that most people in our community aren't immune to, then they're not going to go and shop. They're not going to utilize restaurants and retail facilities unless they know that the proper steps have been put in place to make those places safe for all of us to use. And so building up and having in place those things that allow for that consumer confidence is so important as we go about re-engaging our economy. And so I'm having those discussions with business leaders and community leaders here in Tulsa as we develop that plan. Right now, our orders run through April 30th. There will not be any lifting between now and that date. But I also haven't determined what needs to be extended past that date. We're going to evaluate this in partnership with the Tulsa Health Department day by day, and we're going to proceed with caution. I want everyone in Tulsa to know that when we do roll things back, we're doing them not because people were angry or in a rush to get things done. We're doing them because public health officials believe that they are safe to do. And that's the only time that we're going to move forward on that front. So that's the first one. I just want everyone to understand, what our overall planning is based around. And my expectation would be that as we have those individual plans for things to do, and as we're tracking and getting nearer to a time when we believe that we can re-engage those aspects of our economy, you'll certainly hear about those at these briefings. The second update I have for people today is around the city of Tulsa itself and the city government. There are historically two great indicators that show what we can expect from a sales tax generation standpoint. And that's regional employment. As regional employment goes, usually our sales tax generation goes as well. And also crude oil prices, because that has such an impact on employment in Tulsa as well. And so as those rise, usually our economy does better and our sales tax generation does better. And as many of you know, we're the only state in the country that forces cities to be heavily reliant on sales tax. It's the only tax that we're able to utilize for operations. Cities in Oklahoma can't use property tax. So that makes us overly reliant on sales tax. And so what we see right now is an unprecedented spike in unemployment rates nationally, and we see crude oil prices in the tank at the moment. And those two phenomenon have us very concerned about revenue generation for the city government in Tulsa. And so we're modeling our budgeting moving forward, looking at what we had to do going through the Great Recession in Tulsa. Just like we did last year with the flood, when in the early going, we kept trying to catch up with whatever water release rate people had, whatever the Corps of Engineers was announcing, and we'd create a map one day and then it would be useless the next because they changed the water flow rate. We finally decided we're going to prepare for the worst case scenario, and that was the 86 flood. And we gave everybody maps and everybody prepared for that, and we did just fine. Well, in this case, for us, the worst case recent scenario is the Great Recession of about 10 years ago. And so that's what we're planning for at the city of Tulsa. In order to that, and we're fortunate because we have tools at our disposal that we didn't have a decade ago, like a rainy day fund that the city council and I have been very aggressive in putting money into over the last couple of years. At the outset of this pandemic, we initiated a hiring freeze. At the outset of this pandemic, we also initiated a travel freeze. But in looking at what our projections are for the year ahead, we recognize that even with all of those things, they're not going to be enough to maintain our service levels to protect the citizens of Tulsa the way that Tulsans should be protected. And so we've made a very difficult decision, but a necessary one. I believe that we will initiate half-day furlough days every single week, beginning on May 3rd. And those will run through December 26th. And that is for non-sworn employees at the city of Tulsa whose pay is funded by our general fund that is driven by sales and use tax. Police officers and firefighters and 911 operators are not impacted by this. This will not impact public safety service levels in Tulsa. This also will not impact those employees who are funded through utility rate payments. But for those of us who work for the city of Tulsa, who are reliant on sales tax for our pay, we will be taking the equivalent of a 10% pay cut over the next several months going into December. I say we, I include myself in that. I wouldn't ask any city of Tulsa employee to make a sacrifice I wasn't willing to make myself. And so I'll be taking that pay cut, as will every member of my staff in the mayor's office. We are doing this to protect the jobs of our team at the city of Tulsa. And this kind of reduction in pay, I believe, is necessary going into a fiscal year with great economic uncertainty, both locally and nationally. And so we're going to make these difficult decisions at the outset of the year, not try to catch up midway through the year. So those will go into effect on May 4th and again run through the end of the year. Another update on our small business relief efforts that we have here in Tulsa. I'm very pleased to report that we've had 207 applications for the Resilience and Recovery Fund for small businesses that the city of Tulsa is funding. So far, 15 loans have been approved for that to local small businesses that employ 193 Tulsans. There are additional loans that are being evaluated by the Tulsa Economic Development Corporation right now. So far, the main things that we've run into for those that we weren't able to process loans for were either a missing application information or a lack of just follow-up contact. But I think the thing I'm really excited about, though, that is an important measure that's helping a lot of people. The thing I'm most excited about, though, is that since April 1st, Tulsa Responds, the organization that we set up to help local businesses navigate not just local funding opportunities, but federal ones as well. That organization, Tulsa Responds, has helped local small businesses and entrepreneurs complete over 900 applications for federal aid since the 1st of April. That's tremendous work by the team at Tulsa Responds, and I'm very grateful for them. We had a question earlier at our briefing earlier in the week about the CARES Act. At the city of Tulsa, we're continuing to work with our colleagues in the neighboring counties and with Tulsa County in our federal delegation to evaluate what our opportunities are there. We're expecting further guidance from the Treasury Department to come soon. And so as we have more updates on that front, I will certainly let you know. Lastly, I just want to say that as we're concluding what we believe to be the crucial week for the prevention of the spread of this virus in Tulsa, how grateful I am for everyone who's taken it seriously. When you look at the death rates in Tulsa as they compare with other cities around the world that have been impacted by this, they are so much lower. And that is not because we're so much tougher here in Tulsa or that our immune systems are amazing or that we're so much healthier than everyone else in the world. They are lower because we as a community took action earlier in the event as it hit us locally than a lot of other communities around the world had a chance to. And so for everyone who acted quickly and early, very grateful for that. I'm so thankful. You've saved thousands of lives in our city. And the important thing is that this virus is not going to evaporate into the air on May 1st. It's going to be around for a long time. And so how we can start to evolve the way that we go about our lives from where we are right now, which I think we all agree is not sustainable for the long term, where we are from right now to where we want to be so that we can get our economy re-engaged. That's the kind of work that I'm working with local businesses and with the Tulsa Health Department to help develop a plan that we can deploy when the health department tells us it's the right time to deploy it. With that, I'd like to turn it over to my colleague, County Commissioner Karen Keith.